News Radio WAB 1180 welcomes you to the Seniors Rock Show, presented by the law firm of WESLEY, Clark, and Peshkin. The Seniors Rock Show, a lively weekly discussion, shedding a bright light on aging with fun, entertainment, and important info for all adults. Join us with your comments or questions. Call or text 222-1180 or 1-800-295-1180. Now, from the News Radio WAB 1180 studios in downtown Rochester, here's your host, Joanna Palvino.
Well, hello and welcome to the show. Mike Robinson is off today. I'll tell you that right away. But I am happy to tell you that I have a special guest co-host. Her name is attorney Sarah WESLEY, and she's a founding partner of the law firm of WESLEY, Clark, and Peshkin. And she's with us today. So we're going to have a great show. This award-winning law firm, by the way, is our new presenting show sponsor. And we're excited about that.
Thank you so much. I'm so
You're
excited
welcome.
to be here.
The merger of the law office of Michael Robinson and WCP brings two of the strongest teams in family-related law in our area together. And Sarah specializes in divorce law. And today, she'll talk about gray divorce. Gray divorce, I don't think, Pam, you were supposed to do the clapping for gray divorce. It was a little delayed there, folks. But anyway, welcome. But Sarah's going to talk about gray divorce today. And gray divorce, if you haven't heard this term, refers to a divorce involving individuals who are 50 years of age or older. You might be surprised at what this divorce expert has to tell us. So stay tuned for that. That's going to be in a few minutes. Also this hour, we have orthopedic surgeon and local MD, Dr. Timothy Wagner. He's got an impressive education, and it includes extensive training in complex total hip and total knee replacement surgery. And he's received specialized training in the most cutting edge techniques. We're going to hear about those today. And those are for hip and knee replacement. Specifically, he's trained on the direct anterior approach for total hip replacement, which you're going to learn about. I just learned about that not too long ago. So you can ask Dr. Wagner questions, and you can ask Sarah WESLEY questions if you'd like to at 585-222-1180. And the surgeon will be with us right after the break, Dr. Wagner. But right now, I want to know more about my guest co-host, attorney Sarah WESLEY. Welcome to the show, Seniors Rock, Sarah.
Thank you so much, Joanna. I'm so happy to be here. I know Mike loves doing this show, and I'm so happy to, welcome Mike to our team. We joined teams. I think it's a wonderful match. And we're really looking forward to the future together. But you're absolutely right. I am not Mike Robinson. I am not an estates attorney. But what I do is a lot of divorce work. And that is the focus of our practice at WESLEY, Clark, and Peshkin. So, I guess what we were talking about gray divorce. And I think what a lot of people, don't realize when they're thinking about divorce is that the fastest growing population that's going through the divorce at this time are boomers and folks who are 50 plus.
And that, Sarah, is, obviously it's the largest segment of the population growing too, the boomers,
Absolutely.
right? I like to say that loud and proud. Hello.
Absolutely. Yeah. And, we find a lot in gray divorce. When you're talking about statistics, right? When you're talking about general population divorces, I think people have the misconception that all divorces end about 50% of the time. And that's really kind of a skewed figure. What we find is more that first marriages have more of a 30 to 50% statistic of divorce. And then second marriages have like 60% and third marriages 70, and it goes on. But all of those get lumped together when we're talking about them. But what we have found in the last 5 to 10 years is that folks over the age of 50 are getting divorced more frequently than previously. And very often these are very long marriages, 25, 30, 40 years. And I think part of the psychology that might apply to that is that we're living longer, right? People get through raising their children and into retirement, and they may look at their spouse after, all of those life experiences and say, we just don't have a lot in common anymore, perhaps. And, I might live another 20 or 30 years. So, it might be time to start over. One of the things that we really encourage people who have spent a lifetime building their assets and their wealth and their family together, as to if they find themselves in the position where a divorce is going to happen, that they don't just throw away everything that they've built. Often there are children and grandchildren and life events that everyone wants to be able to be present at.
Hmm.
And there are ways to transition from your life as a married couple into a divorced couple in a really respectful and amicable way, so that you're not putting adult children in a position where, it's Thanksgiving and who am I going to invite, mom or dad, right? And
Right.
so, there really are a lot of options that we can talk about and
Yeah.
work through.
And I think what people are talking about these things more often now too, Sarah. It's more acceptable, if you will. And I hate to bring up, like movie star stuff, but Bruce Willis is an example. I mean, he's
Yeah.
got, a great relationship with both of the wives that he's had, all the children, and they get together. And now he's sick, and they're supporting him. So, it's a great plan, I think.
I think it's really beautiful. I mean, to be honest, you chose this person, you spent an enormous amount of time with them. I mean, obviously there are exceptions if there's
Right.
substance abuse or domestic violence or things like that. Those wouldn't be appropriate relationships to go through what we would call a amicable process, such as mediation
Hmm.
or collaborative law divorce. And, I think divorce was always such a dirty word, right?
Right.
And it I think it got that way because it was perceived as just being a battle to the end. And the reality is what you're doing when you're paying lawyers to fight each other is you're depleting what you've built together, and you're giving it
Absolutely.
to other people, right?
Yeah.
So I think there's the collaborative divorce process, particularly. I have been a practitioner now for quite some time. My partner, Kevin Clark, is a champion in New York State of collaborative process. And he really brought my other partner, Amber Peshkin, and I on board and taught us about this process and said, like, guys, this is the way to do it. Right. So a personal story. I'm a divorce attorney, and about 6 years ago, my parents decided that after almost a 40-year marriage, that it was time for them to, end their marriage and go their separate ways. And so, of course, they called me, and I said, I want nothing to do with this. Don't,
Ah,
don't get me involved. But I really encouraged them to employ the collaborative divorce process, which is really a situation where, for those who are not familiar with it, um, both parties are represented by an attorney. They have a true attorney-client relationship. And then we also utilize third-party neutrals who are professionals who have specific training, such as a financial professional. Particularly in long marriages, you may have built up a lot of assets. And so you may want to have a financial professional in there to help you understand what your budget's going to look like after divorce, um, how to really understand the nature of your retirement accounts, all of the things that you've done. And so in that process, we come to the table, and much different than a litigated divorce or a court-based divorce, we are all working together with the couple at the table to try to come to resolution in a respectful way. And
that's great.
my parents did that. God bless them. I am so appreciative for them to have the respect for their marriage that they had throughout it at the end of it.
Yeah.
And, a month after they finalized their divorce, we as an entire family, my husband, myself, my brother, his children, his wife, and my mom and dad all went on a vacation to Florida. They just got two separate condos next to each other. And,
That's
and we had
awesome.
we had the best time. So,
How
there
adult.
is a
Yeah.
way. There is a way.
Yes, how adult, and they got to enjoy their grandkids and to be with the family together. That's terrific. I really like that. And I have a quick question for you. You mentioned
Sure.
earlier mediation, so I guess I'm curious about what the difference is between mediation and collaborative.
Absolutely. So I think a lot of people, as a starting premise, have a misconception about mediation, that it means you have to have already agreed to everything, or that you're just really getting along perfectly. A mediator is one professional that you work with. Very often they're an attorney. They don't have to be an attorney. We have both attorney mediators and non-attorney mediators at Wesley Clark and Peshkin. But the mediator is there to help you make the checklist of all of the decisions that need to be made in your divorce, and then also to help you work through and come to compromise where there might be sticking points. The big difference between a mediation and a collaborative divorce is that in a mediation, the couple is working with one professional, the mediator. And in a collaborative divorce, you're typically working with three professionals, so two attorneys and that neutral party.
Ah,
So you are getting more people at the table for a collaborative divorce, and um, it's a it's an environment that's more supportive in the event that, maybe in a mediation, one party feels like they really just don't understand what the finances of the marriage are, because people divide labor, right? And one
right.
party keeps track of the books and the other does something else. So a collaborative divorce provides, equal support to everyone there so that they can truly understand what their legal rights are, what, best
Mhm.
may serve them in the future, and to, really kind of have someone with them to advocate and help them advocate for themselves.
So would it make sense to have a mediation and then have a collaborative process?
Sometimes that is a path that folks take. If they're working through mediation and it just doesn't seem to be benefiting one party, they may then step up their support and convert that into a collaborative divorce or bring in attorneys to assist them with that. So yeah, that's not foreclosed. By starting a mediation, you are not foreclosed from following up with a collaborative
I
divorce.
see. So it could be either or both.
Yeah,
Yeah,
absolutely. Yeah.
interesting. Well, thank you for explaining that to us. If you just tuned in, we're talking to Sarah Wesley of Wesley, Clark and Peshkin, and she's going to be with me all this hour because she's my co-host today. Mike's off, and if you stay tuned, you're going to hear Dr. Timothy Wagner next. He's our guest expert. He's wonderful. So stay tuned on News Radio Wham 1180. When you've lost movement, flexibility, strength, or balance, traveling a long distance for physical therapy seems like a bad decision. That's why Agape Physical Therapy has a convenient location near you, east side or west side. And there's a new location in Pittsford with Aqua Therapy. Let Agape Physical Therapy and wellness professionals customize a treatment program for you to help you recover quickly. Visit agapephysicaltherapy.com and schedule your free consultation today. No doctor referral needed. Welcome back to Seniors Rock, and we played that for Sarah today because we heard she'd like to hear that when her parents were playing it, and I'm her parents' age apparently.
That was
But
so
that's
great. Thank
okay.
you.
Right now, we're ready to welcome our next guest, Dr. Timothy Wagner. He grew up in Irondequoit, New York, and that's just outside of Rochester if you're not in town. And he returned here to Rochester to open his practice, where he focuses on problems of the hip and knee, as well as fractures involving the lower extremity. In addition, Dr. Wagner performs total knee replacements using ROSA. And ROSA is a robotic surgical assistant. He's committed to staying up to date for the benefit of his patients, like me. He gave me a new hip and it's working really well. He says he loves medicine, but his favorite place to be is at home with his wife, Michelle, and their three young children. So let's take a minute here now. Thank you for joining us today, Dr. Timothy Wagner. Welcome to the show.
Hi, thank you for having me, Joanna. I appreciate it.
Oh, you're very welcome. And we're looking forward to hearing a little bit more from you today because I think I've told everybody I know that I didn't understand a lot about hip replacement. Why would you until I had to have my own? And there is a difference in them. And also, I have some friends that are looking at knee replacements. So I think Sarah had a question for you on that.
I did. Hi, Dr. Wagner. Welcome to the show.
Hi, thank you for having me.
Absolutely. What exactly is a robotic knee replacement?
So, robotic knee replacement, there's different platforms and different robots that are utilized in the industry now. But basically, I try to inform patients that the traditional way that we did knee replacement was by using different cutting guides and surgeon expertise in surgery to make decisions on the alignment and the overall balance of the knee replacement. Robotic knee replacement doesn't change the implants or the goal or the final outcome that you were shooting for, but it's basically an adjunct that we use during the operation to make those measurements more exact and introduce as little subjectivity as possible. So it's akin to using a laser level to do a job around the house rather than just eyeballing it.
Wow.
Interesting. Yeah, and I'm gonna take you back to the hip replacement, doctor. As I said, I've had the hip replacement done by you, I have another one coming up. And I had no idea there were two different types. Could you please explain to the listeners now what the difference is between anterior and posterior hip replacement? And I know you're trained in the anterior method.
Yep, I traditionally I am trained in anterior and posterior approaches. They're basically two different ways to get into the hip joint. One is anterior, which is an incision in the front of the hip over the front of your thigh. Posterior is in the back, and then there are actually other approaches that are less common in North America today, such as direct lateral, which is an incision on the side, and others that are a little bit more rarely found. The actual hip replacement procedure, once you're inside the hip joint itself, is no different. You're still using the same parts to reconstruct the hip joint, using both titanium, plastic, and ceramic to build a new ball and socket. It's just two different ways of getting into the joint. The benefit of the anterior approach is it's considered what's called a muscle sparing approach to the hip. So rather than cutting through the gluteal muscles in the back of the hip or the buttock, which are important for walking and not limping and keeping our pelvis nice and steady throughout the gait cycle, the anterior approach, we go in between muscles. And by doing that, it aids in having a little bit quicker recovery with a little bit less limping. And there's research to show that that means patients after surgery get rid of the walker and the cane a little bit more quickly and get back to the activities that we've been missing out on.
Well, I'll tell you, doctor, my mom had both. She had an anterior and a posterior, and the difference in recovery was really remarkable. But how long do the hip replacement, how long does that last before you might need any maintenance on it?
The hips that we're seeing now that are wearing out, there's four parts. There's the acetabular component, which is the socket itself, which is titanium. And then there's the femoral stem, which is also a titanium alloy that goes inside the femur bone. And then the plastic liner that goes inside the socket and the ball. And the ball is typically either made of either ceramic or cobalt chrome. Of those four components, the part that most commonly will wear out is the plastic liner that goes inside the hip socket, the polyethylene liner. The ones that are wearing out now are wearing out at approximately 20 to 25 year mark on average, and those inherently were put in the late 90s and early 2000s. There's been significant advances in the way that we manufacture and produce and sterilize those polyethylene components. So we have reason to believe that the implants we're using now are going to last longer and have better wear properties than previous generations, but we obviously don't know that for certain until we see it through. But in a very long-winded way, I would say the answer for most patients with normal body weight and normal activity level is 20 to 25-year expectation.
Excellent. Thank you, Doctor. Now, you're going to hold you in the news because we want you to come back. And folks, if you have questions for Dr. Timothy Wagner, call us, 585-222-1180. And we'll be right back on News Radio, WHAM 1180.
Sometimes in our lives, we all have pain, we all have sorrow, but if we are wise, we know that there's always tomorrow. Lean on me.
Welcome back to Senior Rock Radio. I'm attorney Sarah Wesley. I'm a partner with Wesley, Clark, and Peshkin, and I'm here with host Joanna Paulino. We've been speaking with orthopedic surgeon Dr. Timothy Wagner this afternoon, and we actually have a couple of callers on the line with questions. So, Dr. Wagner, first we have a question from Amy about knee revision.
Hi. I've heard a lot of good about you, Dr. Wagner, but I was just wondering if a knee revision could correct a hyperextension.
Hi, thank you for the question. Very good question, Amy. Knee revisions are done for a multitude of different reasons, ranging from infection to fracture to instability and so on. And your specific question about hyperextension, yes, there are situations where if a knee replacement is imbalanced, that by changing the geometry of the implant or changing out the implant, you can correct it so the knee will no longer hyperextend. This is often something that is done in conjunction, of course, with postoperative physical therapy and potentially bracing, but absolutely that's something that oftentimes can be addressed with a revision knee replacement.
Okay,
Very
thank
good.
you.
Thank you
No
for
problem.
calling, Amy. And we have a question from Norma. She wants to know about robotic knee surgery, doctor. Norma, are you there?
Yes, I am. Good afternoon. I am
Hi.
interested in more information about the robotic knee surgery. Is it available in the Rochester area?
Hi, yes, Norma. We have robotic knee replacement currently at Rochester Regional Health, so at Rochester General Hospital and Unity Hospital. We do them with regularity. The two platforms that we have, one is called Rosa, which is what I use. There's also one called Velis. So the answer to your question is yes, absolutely. At Rochester Regional, we have access to robotic knee replacement.
Is that always available, robotics? Is every candidate available for that? In other words, is that always an option, I guess is what I'm asking.
So it depends mostly on your treating surgeon. Some surgeons are using robotics on all knee replacements that they perform. Some surgeons are using it selectively, case by case, and some surgeons have not adopted it into their practice. So I personally use it for every knee replacement that I do, but it's a good discussion to have certainly with your provider.
Oh, thank you so much for that information. I was under the impression you had to go to either New York City or Boston to get
No,
to
we
get
have
this
a rock star
information.
right here, and that's Dr. Wagner.
We certainly do. We certainly do. Thank you
It's a
very
good
Thanks for your
much.
call, Norma.
Yeah, good question, and thank you. If you had asked that question even 3.5 or 4 years ago, you would have been correct that you would have had to go out of town, but no longer.
Wow. I think that goes right along with the question I was going to ask Dr. Timothy Wagner. Who is a candidate for a total joint replacement, doctor? Is there a perfect scenario?
So there's often a long conversation that I have with patients when we're talking about hip replacement and then knee replacement, and they often get clumped together, but I advise people to think of them separately. Hip replacement is an operation that oftentimes has a very good and reasonably quick recovery. The satisfaction rates in the research are extremely high, and the benefit that you get from having a severely limiting hip preoperatively, and then the benefit that you have after the operation is significant, and it can really change your quality of life dramatically. Knee replacement is also an excellent operation, but the recovery is much more challenging, and there are still a small percentage of patients that even after knee replacement are not entirely satisfied with the outcome. So when we're talking about candidacy, I right off the bat like to talk about stratifying hips and knees differently. As far as being a good candidate, I think, anything that patients can do that's modifiable to lower their risk after surgery and during surgery is beneficial. Things like if you have diabetes, keeping your blood sugars well controlled, quitting smoking, maintaining a healthy body weight, etc. Those things optimize candidacy. But as far as the decision to move forward with surgery, I think when it's to the point where your hip or knee is limiting you from doing the activities you enjoy, whether that's going on a walk with family after dinner or whether that's playing pickleball, paddle, any number of hobbies, when you're no longer able to do the things that you desire to do, because either you have debilitating pain in your groin or hip or buttock when we're talking about hip replacement, or in your knee when we're talking about knee replacement, then I think it's time to at least have a consultation with a surgeon to at least discuss the option of surgery and see if there are other treatment options short of surgery that could provide you significant benefit.
Doctor, mentioning that, are there advancements in other types of therapies like stem cells, or I mean, that you're using in orthopedics to assist these patients?
So there's lots of research that is ongoing when we look at what we call orthobiologics. So that would be stem cells, PRP or platelet-rich plasma, and other derived therapies like that. When we're looking at that, specifically stem cell research, there has not been anything promising in clinical trials to show that we can treat arthritis through those measures. In other words, the wearing out of the cartilage, once it's worn out, there's no secret sauce that we have found yet that it can regenerate cartilage. Now, there is promise in some laboratory research showing those biologics to treat things like tendinitis, rotator cuff tears, more what we would consider in orthopedics to be soft tissue problems. And we are certainly hopeful that in the future we're able to develop things that can aim to regenerate cartilage. But at present, the short answer is no, there's not. For non-surgical treatments for hip and knee arthritis, though, we do have other options as far as cortisone injections, physical therapy, and things like that.
Doctor, there's the music. We have to go now, but thank you so much for joining us today. Please tell our listeners how they can find you.
Yeah, it's my pleasure. For an appointment, my office line is 585-723-7600. And we're located at Unity Hospital, and we have offices in Henrietta and Chilai.
Wonderful. Thank you so much, Doctor. And we'll be back right after the break with more Seniors Rock Radio.
I can see clearly now the rain is gone. I can see all obstacles in my way.
Well, Sarah, as Mike says every week, it's another hour of Seniors Rock coming to a close. And I'd like to thank you for being our guest co-host today. And I'm talking to attorney Sarah WESLEY with WESLEY, Clark, and Peshkin. She jumped right in to help us out today. Mike had to go and do something else. He does get to have some time off once in a while. And it's been fun. I hope you enjoyed yourself too, Sarah. We're not done yet. But I just wanted to mention again that we are very happy to be working with you and the other fine folks at the law firm. And there's lots coming down the pike, and you're going to bring a lot to the show. So thank you for that.
Oh, Joanna, thank you so much for having me. This has been an absolute blast. As you said, it was a little last minute and I got nervous, but you've made it an absolute pleasure to be here. And wow, what an impressive man Dr. Timothy Wagner is, huh? I mean,
Yeah.
just his knowledge base, what he does, I'm sure that so many people are enormously grateful for his work in their lives.
Yeah, I'm glad he came back to Rochester because I benefited for sure. And
Absolutely.
yeah, and I have friends who are asking about him, and I can't recommend him enough. So, yeah, he's a modest person, but boy, is he good at what he does. And most of the experts we have on the show are the same, and that's why we do this show every week. We're trying to help families. We're trying to help everyone who's aging, which is everyone. And now, as I said, that your law firm has merged with Mike. We're just going to make it better every week, and go forward with even more experts. And what's going on this week? Dogs do you have?
I lost you a little bit there, Joanna. I apologize. I didn't hear
Oh,
what
no
you.
problem. No problem. I was just asking what you had going on this weekend. I know you have dogs. You're going to go out for a walk?
So yeah, we live on a pretty big piece of property out in Spencerport. We have 2 dogs who are happiest when they're outside. And we have some friends coming over this evening with their kiddos. We'll probably go play in the mud and maybe order some pizza and wings. So it'll be a nice,
That sounds fun.
nice
What time should we
evening. I'm
come over?
looking
Pam
forward
and
to
I are
it. Yeah.
available.
Come on over for happy hour, 4:30. Show up.
Yes, awesome. Well, I think it's great to do that and to socialize. We say that all the time. It's so healthy. Don't stay home, folks. Don't isolate. Yeah, it's a little bit gray today, but come on, you live in Rochester, and we've got a couple things coming up tomorrow that you could do. On Sunday, April 30th, the Red Wings are going to be playing the St. Paul Saints, and they are going to do that to benefit autism. And it is Autism Awareness Day at the ballpark, and kids can run the bases after the game, so that's always fun. And what else is going on, Sarah? You got any other ideas? I see
It
some other.
looks, yeah, it looks like there's actually a mushroom and moss walks, which has
Ooh,
got to be interesting. Looks like it's at Dishmill Creek Woods at Letchworth. I don't know if you've been to Letchworth much, but I worked there in high school as a
you did?
lifeguard.
Oh,
I
it's a
did.
beautiful place. Yeah.
It was the best place to go to work ever. I worked on my tan and got to be in one of the Grand Canyon of the East. So I
I was
can't
just going to
complain
say
about
that's what they
that.
call it. It's amazing, folks. If you've never been to Letchworth, take a ride down 390. It's totally worth it. Even if there's no mushroom and moss walk, you can do your own thing. But yeah, I bet that was a great summer job.
It was the best. It also
Mhm.
looks like there's an opportunity for a little bit being outside at 1 o'clock on Sunday at the RMSC Cummings Nature Center. The
Mhm.
Heritage Maker workshops are taking place. It's beginner blacksmithing. It's
Ooh,
an ever popular blacksmithing heritage maker workshop. And they're back, and you can join instructor Jonathan Bernard to learn about the art of blacksmithing in small groups. You get hands-on training, and that is all on Sunday at 1 o'clock at Cummings Nature Center.
wonderful. We have so many cool things going on. People always talk about all uh, the celebrations we have in the summer. Every weekend there's another festival or something going on. But you know what? There's things going on all year. So don't use that as an excuse, the weather. Obviously, and again, put a hat on. I say that all the time. Oh, it's drizzling. Well, that's what umbrellas are for, people. So get out there, enjoy yourself, and spring is in the air, and I want you to enjoy nature and other people. And if you see an elder alone, please say hello to them, not just because it's the right thing to do, but because you know that seniors rock.